Hi there, and welcome to another episode of Health with Dr. Yvette. Today, we're going to be talking about a very interesting topic. We're going to be talking about sickle cell disease and living with sickle cell. So, I'm joined by the sickle cell warrior. She's actually a doctor. How many doctors have you heard that have sickle cell? So, she is an amazing person.
Thank you.
Dr. Dr. Muila, welcome to the podcast.
Thank you very much, Dr. Yvette. Thank you. It's an honor to be here.
Thank you for being here so much.
Okay.
We've been trying to get her all week.
Yeah.
Yeah. But you're finally here.
Yes.
To start with, what is sickle cell?
Okay, so sickle cell is a genetic condition where one inherits an abnormal hemoglobin from both parents. So the hemoglobin is practically a particle that is found in the red blood cell that's in charge of carrying oxygen to all parts of the body. So because of this defect, sometimes the red blood cell tends to sickle instead of being biconcave oval. It tends to sickle, and once it sickles, it causes blockage in the blood vessels, and this brings about pain.
Yes.
Yeah.
So I actually made a little illustration here of how sickle cell is inherited.
Yeah.
So we have, so the N is for normal hemoglobin, the S is for a sickle cell hemoglobin, or the hemoglobin that's found in a sickle cell. So when you have mom and dad who are carriers, they'll have a normal hemoglobin with a sickle cell. Then they'll have another normal hemoglobin with this sickle hemoglobin. So if the normal and the normal combine, then you have a child with normal hemoglobin. If the normal and the S combine, you have a child who is a carrier, and if the S genes combine, you have a child with sickle cell. So if the parents are both carriers, they have 25% chance of having a child with sickle cell. They have a 50% chance of having a carrier and 25% chance of having a normal child.
Yeah.
Then if the parents if one is a carrier and the other one has sickle cell, meaning both genes are defective. So it means that if the normal and this S hemoglobin combine, they're going to have a carrier, and in fact they have 50% chance, of having carriers and 50% chance of having a child with hemoglobin. Now, with this said, do you think it's important that people screen for
Yeah,
sickle cell?
it's very important that people screen for sickle cell. So actually, people who are carriers, who are traits, people who carry the sickle cell gene, most of them do not
Do not know it.
exhibit any sickle cell symptoms. So they only know that they have a sickle cell gene in their family or in their blood once they have a child with sickle cell. So most of the time, people only get to find out that they have this condition, and it becomes a coincidental finding once they have a child. So like the percentages, so it's every pregnancy. So it's not just a lifetime. So that percentage is every pregnancy where a couple like that gets married will have 25% chance of having a normal child, 50% chance of having a normal child, a carrier, 25% of having. So every pregnancy, and sometimes some families that unfortunate where they have all their children
With sickle cell.
with sickle cell. Yeah, so it's very important for people to know their sickle cell status so that they can make an informed decision when they decide to get married and have children, if they're really ready to take care of a child with sickle cell anemia, or opt for other options like adoption, so yeah.
Okay.
Or not get married at all. It's up to you, but it's not a test of love. I always tell people that it's not a test of love, but I think it's important to make a decision, informed decision. Yeah.
So that you know what you're up against.
Yes.
So How is it like living with sickle cell every single day?
So it's not an easy journey. It's actually a hard journey. So it's feeling your heart beating every day, pumping blood very fast because of the sickle cell gene. The red blood cells tend to die at a faster rate than normal
Yeah.
rate. Instead of living for between 90 and 120 days, our cells live for between 7 to 21 days. So because of that, we're anemic. So you're always fatigued. Little walk gets you fatigued, climbing stairs gets you fatigued. And sometimes you have all these small body pains in your body. So it's not an easy, it's a reminder of letting you to say you have an invisible disability, even if sometimes you don't look like it. So that's how living with sickle cell can be sometimes. But sometimes you can actually literally forget. Like I remember before my health got bad, before I got COVID, I would go months without a sickle cell crisis, and I would even forget that I've got sickle cell anemia. But yeah, so it's like that. It switches up quickly. Yeah.
What are some of the common misconceptions in the community about
Okay, so the
sickle
most
cell?
common misconception is that people with sickle cell don't live long. They've got short lives. The community considers someone with sickle cell as a walking coffin, as a walking dead, to say these people they cannot live long. But to break that myth, actually, the oldest person who died from sickle cell was 94 years old in Nigeria. She died at 94 years, you know. So that's myth number one. Other people in the community think if you've got sickle cell, then you're bewitched. It's a curse. It can go away by praying for you and whatnot. Those are some of the myths. Yeah. And then other myths, people assume that because we go through pain every day, then we're used to it. Like it's not bad. It's not a big deal. So those are some of the myths. And then the other myths are we are lazy people. People with sickle cell are lazy. They don't want to wash. They don't want to clean and all those things. But forgetting that we live with chronic fatigue on a daily basis. So to mention just a few of those myths in the community.
That's very sad. I remember when we went for that book launch, you mentioned that doctors were saying that you won't live beyond what? Was it
Beyond
3
the
years?
13 years
Oh,
old.
13.
Yeah.
And here you are.
And here I am, and actually the oldest in Zambia living in sickle cell, Auntie Kale. She's actually one of my mentors. She's 70 years old.
Really?
Yeah, she turned 70 last year. But from her point of view, she says they're less compared when she was between the age of 20 and 35. So they're less.
Does she have children?
Yeah, she has a child. She has one child. Yeah, she does.
That's nice to hear.
Yeah.
Does sickle cell sometimes make you think of not having children?
It does. It's a scary thought because remember, pregnancy is a risk even in a person who's normal, right? Now imagine having low HB, having low blood, and then on top of it, carrying someone else to share that blood with, and on top of it, just pregnancy itself is stressful. So yeah, sometimes it's scary. The thought of pushing, getting pregnant, not knowing if your health is going to be bad or good. So in other people, actually their health gets better when they're pregnant. Like I've got few friends who said I didn't even have a crisis when I was pregnant, but with others it's bad to the point that they even need blood exchange and repeated blood transfusion just to keep up. So yeah. Because of that, I've also reduced how many kids I want. Like even just one child is enough for me. And adoption is also a consideration as well. Actually, it's on the
It's on
list.
the table.
It is on the table. Yeah.
How has sickle cell influenced how you look at life and health?
So for me, I appreciate life. Every time I'm alive is a blessing. I don't take it for granted. So I've told myself to be more appreciative because I don't know if tomorrow alive. So I'm grateful for every little things. Sometimes people even say, why is she celebrating? Like, why is she so excited about such a small and trivial thing? So for me, it's living a day at a time. So it has shaped me in a way to say, I live a day at a time. If I make progress, even if it's a little bit of progress, I'm appreciative of it. I'm thankful of it, because I don't know, tomorrow I might wake up in pain, or things might be different. So I appreciate life in its smallest form. So sickle cell has taught me that. And then it's a blessing also in disguise. When you're down, sometimes people run away from you. So it teaches me to say, I've got people who are genuine, that love me and are there for me. So that sometimes there are people who are not, they only want to benefit something from you. But for me, it will not take long until I just get into crisis. Then I'll know, is this my real friend, or this person is just here for the benefits and whatnot. So yeah.
It's a blessing in that way.
Yeah, it's a blessing in that way. I don't keep fake people around me.
Okay.
Yeah.
Well, can you tell us one time where you had a really challenging time with sickle cell?
So one of the moments, recent one, I would say, is I have many. I'll share two. So
Okay.
the recent one is when I had COVID. So I had COVID twice. So the third wave really hit me bad, that I was on oxygen for 2 months, and I was at Levy. So it was so bad because I was also having COVID with a crisis. And then on top of it, I'm allergic to steroids. I'm one of the sickle cell patients. When they take steroids, they have a rebound crisis. So when you read about it, a long time ago, before the research came out, when I used to tell people, say, when I take steroids, I go in a bad crisis. People used to say, it's not possible. But now there is research actually showing it, that says that some sickle cell patients who actually, when they take steroids, they go into a rebound crisis. So it was a matter of I needed those steroids because my lungs were clogging up. So my doctor said, you need them. I know you're allergic to them. I know they make you sick. So I was having a crisis, and COVID itself comes with so much pain on itself. Like, it also comes with body pain. So plus that. So it was a very challenging moment. And I wrote myself off to say, I'm dying. There's no way I'm going to survive, because people who don't even have sickle cell are dying from COVID. Like, the chances of me dying were higher than somebody else. So, but what kept me going was my faith. My pastor really helps me to say, you can still, you've gone through so much in life. Even this time, you can still go through it. And what I started doing was counting my blessings. Being a doctor, it's very easy for you to say, oh no, I'm dying. Like, your results are bad.
Yeah.
So when my results came back, when my platelets were reducing, right, because I reached about 900 because I was clotting. So whenever they bring my results on a daily basis and they've started reducing, I'd rejoice to God. Whenever I would walk a bit in the word, I would count those blessings, and I just started thanking God. So that's how I maneuvered through that situation. And the part of me sometimes was feeling like I'm wasting time. Like, I'm here, I'm not doing anything, I'm just on the bed. Like, time is passing. Like, I would have been doing this something better. But I told myself, I'm at a hotel. Like, that's what I told myself in my mind. Like, this is vacation. I'm on vacation. Let me just
Hotel Levy.
imagine that I'm in Italy or something, and this is my hotel room. Just having that positive mindset was what made me go through, navigate through that situation. So, and then the second experience was when I was 8 years old. So when I was 8 years old, I was diagnosed with a tumor on my liver.
Okay.
Yeah, so I had a tumor on my liver. So this tumor, I had it like from the time I was 4 years. Everybody was assuming it was a spleen, until one doctor took interest and said, there's no way we can be saying palpable mass for 4 years. What is this? What is it exactly? And from the symptoms, it didn't look like it was a spleen, sickle cell sequestration. So actually, her name is Dr. Kankasa. She's the one who actually saved my life. So she took the interest, did more tests, and it was found that I actually had a tumor on my liver. So this is a place where I actually got inspired to be a doctor. So before surgical ward for children, then there was no surgical ward for kids. So I was in G ward. Like, I was the only kid in there. And professor would always carry me to his lectures. Professor Kraiko, he's late now. He would carry me for his lectures, tell the nurse to put me in a wheelchair, then would go to the lectures, and then he'll be teaching. the postgraduates, and I'll be there, and that's how I got intrigued about living with like becoming a doctor and giving back to the community, so that's how I developed interest. From there, at 8 years, I was now sure to say I'm going to be a doctor. So that change of environment and being positive, because when I had the tumor, it was 50-50. So I was saying I might make it, I might not make it, but I didn't see death. For me, death was not an option. I knew that even this too will pass, and yeah, so being positive is one of the things that has helped me come through those difficult moments, and telling myself to say this too shall pass. Yeah.
So did they operate on the tumor?
Yeah, they did. They operated on me and removed the 2 kg weight.
It was 2 kg.
Yes.
That's a lot.
And that's how I changed, because I used to be tiny, I used to be small, like I wasn't growing the way I was supposed to. Like that's how, after that tumor was removed, I started gaining weight. I became a chubby girl. You couldn't even know that I've got sickle cell unless I told you that. But before the tumor was removed, I was so drained. So imagine I was carrying a 2 kg from the age of 4 years to 8 around with me. And initially, we were supposed to go to South Africa, but as a family, then they couldn't afford. So that's how Professor Kraiko took it upon himself to say, I'll operate on her. And I had to stay in the hospital for 6 months. And he really took care of me so well that in those 6 months, I never had a crisis. Like, he wrote up and said, okay, after so many days, she needs to be on IV fluids. He made sure I had a good HB, like very comfortable. I was the first patient he would see whenever he walked into the ward, whenever I was doing a presentation.
Okay, that's good.
Yeah.
The thing about sickle cell is that you get to have a lot of visits.
Yes.
To the hospital.
Yeah.
And I'm sure many parents really struggle with that, because it's hospital admission after hospital
others
admission.
Even lose their jobs because their bosses don't understand.
Others lose their jobs, others lose their marriages, families fall apart. So what advice would you have to parents that have children with sickle cell, or people with sickle cell themselves?
Yeah, so the advice I would give to parents with sickle cell is, I know they're most affected, because I don't think it's easy to see your child go through pain, and feel hopeless where you cannot help them. But one thing I would advise parents is that, as a plus, people living with sickle cell anemia, if they don't really have those bad complications, are actually smart kids. We are very smart, intelligent, and you have those moments. Just know that this too will pass, and you will also have beautiful moments, where your child will make you proud and happy, and this lovely child. So don't give up on that dream. Don't give up on that child. Because for me, I wouldn't be here if my mom didn't believe in me. I wouldn't be a medical doctor if my mom didn't believe in me. But she believed in me. And one thing that helped was, when I'm not sick, I was treated like my siblings. Like, there's nothing special about me. Like, I would do chores. Like, they never made me feel like I'm different. You understand?
Like you're sick.
Yeah, like a sick person. So I knew when that moment comes, my sisters, my mom will all be around me. Yeah. And then to my fellow sickle cell warriors, the first thing I'd advise you is acceptance. Accept your condition. Once you don't feel ashamed that you're living with this condition, is the moment you're going to start living a happy and full life. Because I remember at some point, I also went through depression. Like, I didn't want anybody to know that I have sickle cell, or hear anybody call me the sick one or anything. Like, I never even used to share it, like talk about it. And the thing with me is that if I don't tell you, you won't know that I've got sickle cell. And then at that moment, I never even used to look like a sickle cell patient. So I was in denial. Yeah. Like, I was in denial. And I also got less crises compared to now. Like, there were less. When I was younger, there was so much. Then there was a break. Like, where I would have them a few times. And now, after growing up, they've started, like, they have increased a bit. So I would go, my friends would not even know that I've got sickle cell until maybe I get in a crisis. So I was in denial. I wanted a miracle from God. I was praying for my healing and all those things. And it made me a bitter person, an angry person, because it felt like I'm cursed or whatever, But once I accepted my condition and accepted to say this is sickle cell, I began to see what purpose God has for me in my life. Like what what can I do, with how can I live a life of purpose despite having this sickle cell. Yeah. So be honest with yourself. Accept it, number one, and then two, be honest, be open. We see people pretend to they've got sickle cell. They don't want their boss to know. They don't want their partner to know. But I've seen these things actually backfire. I had a family friend who went on and got married without telling her husband that she was a sickle cell. And then now she started having these bad crises. She started having miscarriages. And this marriage didn't last because the guy thought, you didn't tell me, you'd have given an opportunity for me to accept. I've seen people get fired from work because they were not honest with their boss, and you also want to keep up with other people. You need to know that you have an invisible disability, you've got limits, and it's okay. You can't go partying all night with your friends. You're them that are gonna sleep. You're the one's going to be rushed to the hospital crying, in pain. I actually have a patient like that who went on a drinking spree and became dehydrated, So
And that's a trigger.
Exactly. So you need to know yourself, accept yourself, know your limits. So the day I told myself I'm living with an invisible disability, that's the day I started living life. Because now I accepted my limits, I accepted what I can do and what I cannot do. So yeah, so be honest with yourself. So those are some of the advice I could give people living with sickle cell anemia.
Okay. Do you get offended when someone calls you a sickler?
No, not anymore. Really, I think I've said accepting it, although it comes from a place. Okay, so doctors called sicklers because of the name of the disease.
Because it's sickle cell.
Yeah,
yes.
but with the community, they kind of took it like sickler comes from the sick person.
Yeah.
So it depends on what terms it's said in. If you come and say, if we're having maybe we're having an argument, right? And then now you want to throw shade about my disease and say after a sickle and whatever, that is offensive. But if you're just talking to refer to me or the condition generally, then no, I don't find offense really. Yeah.
What challenges have you faced with the health system in Zambia?
To be honest, when I was a child, it was so easy to get treated. All I had to do was just tell my mom I'm sick and they'll take me to the hospital. And my pain will be believed, there'll be no argument. But now, when you grow up, there's a lot of stereotyping. And the controversy comes in because of the type of painkillers we receive. We go through so much pain. So we need opioids sometimes for these pains. And sometimes doctors and nurses will go like, you're just addicted to it. You just want this drug and everything. So it's stressful. Those are some of the challenges I would say, especially as an adult sickle cell patient. Because it's a lot of, why should I start convincing you to say, I'm in pain? For me to leave my home, my bed, nobody wants to leave their home at 01 to come and receive pethidine in the middle or morphine at 01, even if you are addicted to it. And then who's an addict? Really? So some of those words are really offensive. So those are some of the challenges. And then just people generally think sickle cell is painkiller, water, IV fluids, then it's done. It's bigger than that. Sickle cell is deeper than that. And sometimes I just feel like the health profession, the people just don't want to read about it. They assume they know it and yet they don't know it and how deep it is. I how wish we had, though we have a course like a master's in HIV AIDS. How wish you could have a master's in just sickle cell, because sickle cell affects every part of your body from head to toe. So people don't know sickle cell, people don't know basics. Sometimes I have people even just like call me and they're from the village or like far away, Mongo and whatever. They don't even know the use of folic acid. Like the point of contact, the health point of contact, that doctor doesn't even know that the person needs folic acid. I've had moments where my HB is low and the clinician suggests to say, let's give you iron sucrose. I'm like, but we can't give iron in sickle cell. Exactly. The times when I've gone for a scan, I'm doing an abdominal scan, and this radiographer starts panicking and saying, I can't see your spleen. I'm like, if you know that at this age, I've undergone autosplenectomy.
Yeah.
So what scares me is from those basics. People don't even know the basics, So that's where the challenge is. I think we need to train more people. Yeah, but they're actually also good doctors, who know what they're doing. For example, Dr. Sambo, Dr. Mwandama, Dr. Chunda. Those are people who know what sickle cell is, and if you're seen by them, you're in safe hands. So they're actually also good doctors, but there are a few. So I wish it can be leveled up, Yeah.
Okay. So I really got interested in that the opioids. You said there's this conception that some of the sickle cell patients are addicted. But opioids are addictive.
Yes.
So do we actually have sickle cell patients who are addicted?
Yes, they are. So research shows about 10% of sickle cell patients.
Only 10%.
Yes, can actually now the number has gone up. Then it was about like 2%. So but now the number is at 10%. So what we also as a physicians are the reason why we have sent these people into addiction, because I've noticed.
Oh, but if we don't give you, you're going to say that.
So there's a way
stereotyping
this is what
you.
happens. We withdraw opioids the wrong way. You don't drastically just stop opioids. You're supposed to taper. Okay, it's also our environment. Maybe we don't have enough. So what you're supposed to do is supposed to taper down. So if you start morphine, right, you control the pain. You just don't go to zero. Okay, so what happens, because if you just stop, the body goes into what we call withdrawal. And then with withdrawal, with the sickle cell, withdrawal comes with pain. And then the process of going through a withdrawal will take that sickle cell patient into a crisis. So now they have this cascading cycle going on and going on. And then also remember that before someone reaches addiction, there's tolerance, then dependency, then addiction. So sometimes doctors will see their patients become dependent and not consult the psychologist,
But how are we going to know that?
So dependency comes in, like, for example, where your patient now is dependent. Like if they don't give them the opioids, they cannot function.
But then you're going to tell us that you are in pain. And it's very hard to argue with someone in pain, because they say each kalipa chumfo. So it's very hard for you to know that, okay, now this person is just being dependent. So what advice would you give us, the healthcare workers?
And then there's no enough information also, because I only learned about opioids and their side effects because I'm in a medical field, but I don't remember ever that conversation ever being had with my mom. You understand? So those are some of the things even as a doctor, you need to sit down and say, okay, we're giving your child this, but you need to look out for this. So that when you see this tendency coming, you alert us. And then there are also in the United States, like in other countries, developed countries, there are drugs that you give so that the patient doesn't go into dependency. So there's what we call clonidine. So when a patient is from having that high doses of thing, you can put them on clonidine so that they don't go through the withdrawal symptoms, which might cause them to go back in a sickle cell crisis. Okay. Then they also go on a break. So there's naloxone, right? It's a combination of an opioid and then naloxone itself. So you give a patient, once they're out of pain, you give them that so that their receptors are desensitized, and so that you continue keeping the same small dose.
I think the concept of pain is
no, like for example, I'm out of I'm out of pain. Like I had this long, because sometimes I've got these long hospital stays, like 2 weeks. You've been giving me all this morphine and whatnot, and you want me to go back home, right? So the pain, because naloxone work now as both a painkiller and also desensitizing your receptors, so that next time you come back, you're still on the same dose. So those are some of the things we don't actually practice that we need to be practicing. You understand? Yeah. And then also when an addict walks into the hospital, so if you're addicted to opioids, right, obviously if you have a place where you get them from, You understand? You don't even need to come to the hospital. So most of the times when an addict walks into the hospital, then they're actually in a lot of pain. You understand? Because they know where to get the.
What if the addict works in the hospital? Then what
exactly
happens in that case?
But yeah, okay, yeah, because we also have those cases. I don't want to go in depth. We have
Yeah.
those cases. So it's wild, Mandy. So but at the end of the day, so I feel like there's a place also. What hurts sometimes the stereotyping is someone walking in pain, right? You have a concern that they're addicted. Like manage them, make them better. Not in the moment where I'm screaming and crying, I'm in pain, and then you start telling me I'll not give you your opioids because you're an addict. Like, why not manage my crisis? Then after now you have managed me, I'm fine, I'm okay, I'm at a normal state. Then you sit them down and say, look, I think you might be heading to this direction, because of whatever you point out the symptoms and the behavior and whatever. So is it possible, can you seek more advice? Because again, it's not a physician's place to manage an addict. You remember this? That's why the psychiatry guys are there, and you can always do a consult with them to say, I have this patient, and these are the symptoms they're exhibiting. So how do we manage it? So it's also the time and place.
Okay.
So, but one of my good friends says, she's also a medical doctor and a sickle cell from Nigeria. She says, if a sickler walks in and they're addicted and they know where they get their medication, it means that they're really, really in pain. You understand? Because there's no point of coming to the hospital when they know where they can get it if they're not in pain. It means they really, really need their help, their pain. And actually, one thing I've noticed is that they actually go through more pain than even us. You understand? Like, people are not addicted because whenever they don't take the medication, they're going through a withdrawal. And like I said, the withdrawal sometimes comes with pain. Yeah.
Your Nigerian friend is she the same one who comes up with those articles? Are they articles?
Yes, the ones I love sharing. Yes.
I read some of those.
Yes.
Like some offensive things to say to sickle cell patients.
Yes.
Like telling them that they're not really in pain.
Yes.
Asking them how long you've had the condition when it's inherited. Yeah. I read that. Okay. Yeah. That's very...
So I'm actually very intentional myself. So I follow a lot of sickle cell pages, just to be intentional, just to get like and also to be intentional, to feel, so that I don't feel like I'm alone in this world, like why a lot of us. And I actually I've like her, she's a medical doctor like me, and living with sickle cell. So it helps to know that she's gone through what I'm going through, what challenges I'm going through at work and all those things. So So
I know you're an advocate. But do you have some awareness programs, or are there some awareness programs out there, or some sickle cell groups that help people living with sickle cell disease?
Yeah, there are actually many. So some of them are even actually like private Facebook pages. So we've got a number from America, from Nigeria, and also our own in Zambia, like Mwanza is one of the mothers with the child with sickle cell, also has a group. What do you call it? She calls it Sickle Cell Chronicles, something like that. Though there's so many. So we have even WhatsApp groups, where mothers and children, and myself, I also have I started the all girls support group, like 18 years and above. So yeah.
Why all girls? Because sickle cell is not just affecting the girls, affecting the boys also.
So the passion for me comes from a place where I've lost friends who I consider, so it's called Sisters by Genetics.
Oh, okay.
So it came from a place where I lost good friends of mine, and I wish that if I had a forum like that where I would check up on them on a daily basis, like I feel like I missed out on life. So, and then some of the issues, like pregnancy and all those things, are some of the challenges that we go through. Dating is hard, so I just created a space where it's just safe for girls to talk about. So that's why I did an all girls, but I'm also working on starting an all guys. So the thing with guys living in sickle cell anemia, they really don't open up much. No, they don't come out. Even when we have an event, even when we have an event, there'll be less sickle cell, maybe even one. So I've been talking with my friend Ignatius, is one of the sickle cell advocates, who's a guy. if we can find a way of starting also an all guys sickle cell support group and all women. Like I just, for me, I just feel like, we should categorize people based, because sometimes when you have mothers, children, males in one group, sometimes
it's different.
It's the topics will be not, people will not talk
because
they
they're
will,
affected differently.
yes, affected different. And sometimes even as girls, you won't open up and say, me, when I have sex, I get sick, I get in a crisis. Are you going to do that in a group where your mother is? So
No,
you're not.
obviously.
So far so good. It started last year in December. We've had, no, actually November, we've had 2 outings so far. So yeah.
Have you noticed I'm wearing red?
Yeah, I've noticed. Yes.
This is your color, isn't
Yes,
it?
it is our color. So
Yeah.
burgundy is the color for sickle cell awareness, actually.
Yeah. Okay, it's actually burgundy, not
Yes,
red.
it is.
Yeah.
It is.
Okay, that's very good. So has the sickle cell awareness increased over the years?
Yes, it has. Remember when I was among the first sickle cell advocates on Facebook, I was the only one talking about sickle cell. It was frowned on, people didn't welcome it. But today, being a pioneer of sickle cell advocacy, we've got so many other people who are sharing their lives, so many people, groups and whatnot in Zambia. So it has increased, because a long time ago it was considered having sickle cell is a shame. It's a death sentence, you're not going anywhere. People didn't want to talk about it. But once I started, I opened windows and doors, and some of these girls even inspire me, from the work they're doing, and they're doing a very good job. So yeah, sickle cell awareness has increased. Yeah.
And are there more advanced ways of treating sickle cell, either in Zambia or that have not yet come to Zambia?
So one of them, although we started very late, hydroxyurea has been there for a very long time. So one of them is availability of hydroxyurea now in Zambia. Something when it's been there for so long. I remember when the first time I was prescribed hydroxyurea, I was in 4th year. And it was being done in a wrong way. I was being told to take a tablet, and then after one day, you skip just like that. And then I was told to stop, at some point. But now at least it's mandatory. At least if you walk through UTH and you are being seen by the hematology department, we recommend that you're on hydroxyurea.
Okay.
Yeah.
I remember there was a criteria. Are they still using a criteria, or is it every sickle cell patient?
So yeah, a long time ago, the criteria was someone who has 3 crises in a year should be on hydroxyurea. But no, now it doesn't matter, because I've seen the benefits of hydroxyurea for sickle cell patients, because it has got more than, it's not just about reducing the sickle cell crisis, but has other mechanisms that protect your organs, reduce sickle cell complications such as strokes, acute chest syndrome, avascular necrosis, all those things. So it has been seen to be beneficial. And it's actually even better when the child is young, because the bone marrow is still active, it hasn't been overworked. Because it has been noted that sometimes in adult sickle cell patients, they don't respond well to it. Like myself, I haven't actually responded very well to hydroxyurea, but I keep taking it because I've seen my HB doesn't drop as much as it used to. I would have repeated blood transfusions and also infections and all those things. So that's the reason why I still take hydroxyurea, because it protects me from that, even if it has not really helped me on the pain aspect.
Okay. Yeah. Well, I hope someone out there has understood the importance of hydroxyurea.
Yeah.
Because when I was in pediatrics, there are mothers who would come and say that the hydroxyurea had run out and they didn't refill.
Yeah. So those are some of the challenges I also faced because I was working in the hematology department. So on paper, it's showing that the child is on hydroxyurea, when you're reading the file. But in actual sense, when you ask them, when was the last time you took hydroxyurea, then it's not there. But it's also, we're actually advocating for it to be free. That's what we are praying for.
Oh, so it's not free?
No, it's not. So if ARVs are free, then hydroxyurea can also be free. Those are some of the things we're advocating for. But one of the things after World Sickle Cell Day, I don't know if you saw the announcement, Ministry of Health, through the Minister Masewo, Novast is actually a company that produces hydroxyurea. And I've accepted to say they'll come and build a center of excellence in Zambia, a sickle cell center of excellence, and also provide hydroxyurea for sickle cell patients. So we're looking forward to that project. That was the best news we've ever heard.
Oh,
Yes.
that's awesome news.
Yeah. Then the other question you asked, advanced. So actually, the cure of sickle cell has been discovered. It was announced in December last year, both in the United States of America and the UK. So yeah, so there's a new treatment for sickle cell anemia. Though it's expensive, it's $2 million, but the
$2 million
US dollars. it's expensive.
It
so
is.
very expensive. But we are happy. At least I know that a child born with sickle cell in the next 50 years might have a chance of accessing that treatment. Maybe it would be less expensive, but all the people who are on trial were tested negative for sickle cell.
So what is it? Is it like a stem cell transplant?
Yeah,
a bone
so
marrow?
it's more like a stem cell transplant where they will get. So now you don't need a donor. Remember, with a donor, you have to be on all those immunosuppressants, and sometimes it might not work. You might not find a match. So with this one, they get your own bone marrow. Then they do a mutation on it. They mutate it, and then they put it back in you. So you don't need.
That's
You
why
don't
it's
need.
expensive.
Yes. That's why. Yeah, that's what it is, expensive.
Yeah,
So it's actually running on the same concept with hydroxyurea. So the way hydroxyurea causes fetal hemoglobin to be produced, it's the same mechanism where they kind of tackle your bone marrow, and then it starts producing.
Okay.
Yeah.
That's really interesting.
Yes.
Okay. Any last words for our viewers? And may you please also tell people how they can avoid sickle cell crisis.
All right. Last words of my buzz. So my last words be honest. Like I said, like the most important thing, be honest, be open, and then don't stop dreaming. You can be anything in this world. Like, today I'm a medical doctor right here. I made it. People told me, no, don't do medicine. It's too hard. It's too it's stressful and all that. But I am here. You can be anything you want. Don't stop dreaming. Just because you're doing things at a slow pace doesn't mean that you cannot make it, So at the end of the day, God still gives us this cross to carry, for a reason. Yeah. And then to society, I always say love is the real cure. Love is a real cure. I believe a sickle cell patient will thrive as long as they're in an environment where they're loved and supported. Doesn't mean if your friend or your child has got sickle cell anemia, then they're used to the sickle cell anemia, then the pain is not as bad. Like by now, they've been living with it for 30 years. I'm sure the pain is not bad. Check up on them, because sometimes it can be a lonely place. It's a very lonely place. And then to employees, let's be inclusive. Let's be inclusive. Let's understand that they're not lazy, but they have an invisible disability, and let them do work based on at their pace. If you can give them a chair to sit down, if the job consists of them standing the whole day, give them a chair, let them sit down and rest a bit. If it means you reducing the hours for them to work, reduce the hours, because at the end of the day, they need to live life. They need to have careers, they need to be able to take care of themselves. So yeah, those are some of the things I can say.
And then a few things on how they can, a few words on how they can prevent sickle cell
crisis.
Yeah.
So first and foremost, I'll start with this one. So sometimes doing nothing will cause a sickle cell crisis, right? Like because the cells in nature themselves are sticky and whatnot.
Yeah.
But I always tell people to say, I would do my part, so that when I get into a sickle cell crisis, I shouldn't feel like maybe if I took care of myself better, maybe I wouldn't be in a sickle cell crisis. So if it's cold, keep warm. Because when it's cold, the blood vessels constrict, and remember our cells are already sticky and whatnot, there'll be a blockage. When it's hot, take a lot of water. Make sure you're drinking enough water. You're cooling yourself. Infections, make sure you take your anti-malaria every week so that you don't get malaria. I always say, whenever I had malaria, I died a little, because malaria is so bad with sickle cell. Like, it's very bad. So let's do that. So what have I said? Keep warm, and then take a lot of water. Take a lot of water. You need to drink a lot of water to help those cells to go around. Remember, they're already sticky, they become sickled, so you need that water to go through, so all those things. And then emotional stress. So don't be sad, don't be depressed. Those are things that can trigger a sickle cell crisis. Then physical stress. You cannot want to start dancing the whole night in a club. On top of it, drink alcohol on top of it.
That just
And
makes it worse.
because you're trying to keep up appearances and keep up with a certain group of people. So you have to take care of yourselves. And then do your checkup. So go for clinic. Don't only come to the hospital when you're in a crisis. We have what we call sickle cell clinics every Friday here at UTH. I'm told even at Levy, and I'm told Matero and Kanyama has also started. Go for those clinical checkups so that we can catch whatever it is early. You don't want to catch things late. And also the doctors can plan for you to how they will handle you when you're in a crisis, because you're going there every day. They know you, they know what complications you probably could be prone to, and let's take our drugs. So those are some of the things. Take your folic acid every day. It looks like a useless pill, but it's very important. Be intentional. Take it upon yourself to live a healthy life. Eat a balanced diet, drink your water, rest, listen to your body. Me, I always listen to my body. When my body says I can't, I can't.
You can't. One of the complications that I came across in pediatrics, so there's this boy, he must have been 13, and he came in with priapism, and it was like 24 hours he didn't tell his parents anything, because of course, I mean, having this prolonged sustained erection,
and no one has ever told him about it.
Yes, no one ever told him about it until it became so bad that he had to tell his parents. So he was embarrassed to tell his parents because, of course, because of the organ involved. And when he came, then we explained to them, and it all made sense. Because even the mother was like, hey, like, what was happening? Like,
trying to make the boy sound like he just doesn't listen. Like, what was it doing?
Yes, because she didn't know any better. So you couldn't even judge until we explained to them and told them how to avoid it, and they were okay. They understood. The parents understood, and even had a little laugh about it, just to make him feel more comfortable. So thank you so much for coming. I feel like sickle cell is something that we don't talk about a lot, and
it's very
we have
common.
it. It's very common,
and a lot of it is actually undiagnosed.
Yes, and I'm sure people are out there in the rural areas having their children sick, and they just don't understand why.
So I actually have a friend who works in Wapula. She says, just when you ever see anemia, sickle cell anemia in a child, like you just see low blood and whatever, and you do a sickling test, it's positive.
So some of the early presentation would be swelling of the hands and swelling of the feet, because this is where you have very tiny vessels that can easily just clog up.
And then the village, they go to the witch doctor before going to the hospital. So.
And then they'll probably say that the child stepped on something or ate something. It's very common, and it's very common in Northern Province. Now, I was looking at your name. Your first name is Musonda,
Yes.
And I was like, Bembas.
It's actually very common, even to the point that the other time I found a Tonga who was sickle cell, I was actually surprised. In the word, I'm like, Tonga, like both your parents are Tonga, but
there's some Bemba somewhere.
Yes, so it's actually common in the northern part and the eastern part of Zambia. Yes.
So if you're in the northern part of Zambia, we now have a test that can determine whether you're a carrier or not. Okay, not just in the northern, let's just say the whole Zambia, because it can affect anyone. We can't tell who is a sickle cell carrier just by looking. So do the test, especially if you're planning on getting married. I think sickle cell could be one of the things that we check for, so that you make an informed decision as you get married.
Because it's a painful disease.
It's
very painful. So I
can imagine. because just when you wear something tight, for example, you have a tight band around you and there's no blood flowing this side, you can actually feel the pain. So I just imagine that happening in a sickle cell patient every single day, or most of the time. But
all right, thanks, doc.
Thank you so much for coming through. It was very informative. I hope everyone learned a thing or two. And if you're living with sickle cell, here is living proof that you can be anything that you strive to be. She's a medical doctor, and she's
a businesswoman on other days.
Businesswoman. She's a sickle cell advocate, and talk about it with your friends, family. You don't know who you're encouraging, eh?
True.
Yeah, anytime you talk about it, you're encouraging someone. Yeah. So this was Health with Dr. Yvette. Thank you. Bye-bye.